Hey guys, it's Sarah here. In this video, I'm going to be going over fundamentals, and the topic that we're going to be discussing in this video is going to be medications, like the roots, all about it, etc. So first we're going to be starting with the patient's rights regarding medication. Number one, they should be notified about the usage, the side effects, interactions, everything that they have to know. Number two, they have the right to refuse. If they're alert and oriented and they're an adult, they have the right to refuse the medication, even if it could cause them X, Y, and Z. Number three, they have a right to be told if they're part of an experiment. Number four, they have the right to not get them unnecessarily. So if it's not needed, they should not be getting medication because they have a lot of side effects. And the last one is that they should be informed if they're part of a research study. For instance, they're a new cancer drug that's not FDA approved, but it's a research study, they should be informed. Okay, so this slide, we're going to be going over the nursing process related to medication. So we always start off with assessment. Under assessment, we talk about their history, which includes their allergies, which is very important when it comes to medication, what medication they're on, because it can interact, their diet, history, like their whole history. Number two, we want to assess about the attitude to medication. You know, certain patients' culture, they don't like medication. Third one, adherence factor. Are they going to adhere to it? Is it the type of medication that you need to take 3 times a day and they're not available to take it 3 times a day, they're at work? Or is it the type of thing that you have to be exactly on time and they're never on time? You have to assess all that. And also their learning needs. Next we go on to diagnosis related to medications. So these are some common nursing diagnoses that you could pick related to medication use. Anxiety, deficient knowledge, so they don't know about the medication or how to administer it. Non-compliance, for instance, if they don't want to take their medication. And impaired swallowing, which is very important to know because you don't want to give someone something oral they're not able to swallow it. Okay, next we go on to the next nursing process is planning. So planning for medication. You should be organized. You should have the goals and outcomes before you give it. Always priority, so you want to provide the most important information about the medication before you give it. And always your coworkers, you want to collaborate. If you have any questions, some medications need a 2-nurse sign-off, so you need your coworkers. The next one is implementation. So implementation in regards to the medication includes a few factors. Number one, teaching. You want to teach the family members and the patients about the medication before giving it. Number two, we also have the calculating of the dosing. A lot of medications you have to calculate the dosing. Of course, we have the administration of the medication and then the recording. The recording is documenting. Last but not least, we go on to the evaluation part of the nursing process. So what you're doing is you're basically evaluating, is the desired effect met? Let's say you wanted them to pee out water with Lasix. So did they pee? Are they not peeing? Etc. Or if you give them pain medication, are they painless now? Or a decreased pain? So you're doing expected findings versus the actual findings. So what do you expect them to have? And now what actually happened with the medication? Now we're going to be going on to medication administration. So we're going to be going over all different ways to give medication. So let's get started. Number one is oral. Oral is the easiest way to give it and it's the best way to give it, if appropriate. The one thing you want to watch out for in terms of doing oral medication is aspiration precautions. So if someone is at risk for aspirating, then we don't give this to them. We go on to topical medications. Topical medications, you basically apply to the skin, like creams, etc. And one type of medication is transdermal patch, which let's just say you have a fentanyl patch there. It's a pain medication patch that you put on. The way you do it with the patches is that first you remove the old one before putting in a new one. You want to document the location of the patch. That's very important, especially for the next shift to know where to remove it from. And you want to ask about their patches when you're going through the medical history because that is a medication. And you want to label the patch and then document the removal. That's basically that. So next we go on to installation. There's a whole variety of ways you could do this also. Through the rectum, like a suppository, the vagina, ears, eyes, nose, throat. You could do a spray, drops, someone could put a tampon in, all different ways that you could install stuff. With the eye, if you put it in the eye, you always want to avoid the cornea and avoid the eyelids. So you don't want to put it directly on, you want to put it away and then drop it in. And you never want to share eye medications, especially because bacteria could spread, etc. When you're installing into the ears, you want to make sure that it's room temperature. You want to use sterile solution, and you want to check if the eardrum ruptured. So you want to check if they have drainage first. In terms of rectal installation, you always want to place the patient in Sims position. Next, we go on to inhalation. That's another way to give it. So think of your metered-dose inhalers, your dry-powered inhalers, and you want to teach the patient how to use that. Another way we give medication is through irrigation. That is usually to clean the wound out, usually with sterile water or a septic solution. Another way we give medication is parenteral, so not the oral route. And for this, you're going to use a needle. The needle has the hub part, which is the colored part of it. The needle has the shaft, which is the long needle-like thing that comes out of it. And then you have the bevel. The bevel is the tip of it. You always want the bevel to be up. Under parenteral, we're going to teach you what an ampule is. An ampule is basically a glass. So when you're pulling up the medication, the whole container that you're pulling it up from is glass. So number one, you want to watch out for your hands and fingers when you break it. Use something, not your fingers, because you don't want to get glass on it. And number two, we have to draw it up with a filter needle. And the reason for this is because we don't want the little, let's say you broke it and the little pieces of glass that you can't even see fell in there. We don't want it to be given it to the patient. So use a filter needle. Okay, then we go on to how to do it. In terms of how to do it, this is very important because if you give the medication, let's say you're giving a medication in someone's muscle, and then you give it a little bit below it, you can miss the muscle and put it right into their sub-Q, not going into the right place you want it to. It's going to take longer or shorter depending on where you put it, and it'll irritate the vein, etc. If you are giving a subcutaneous injection, number one, you want to rotate sites because you don't want to have tissue damage if you keep doing the same site, because a lot of people get injections every day. And number two, you want to give it on a 35-degree angle. And if you're doing an IM injection, it's going to be straight, so 90 degrees straight into the muscle. In terms of IM injections, I have a whole video on that. It's a very quick video. It explains from A to Z what you have to know on how to do IM injections. Like, for instance, you use the Z-track method, which is basically pulling of the skin and putting it in the middle so you actually get to the muscle. To go on to intradermal. So intradermal is for skin testing. We use that for like PPDs. I'm sure you got yours before you became a nursing student. It's slow absorption from the dermis, and the angle you want to insert it is 5 to 15 degrees. When you do that, what you want to see is a small bevel is going to form, like a small little block. And last but not least, IVs. So in terms of IV, you have like your bolus IV and you have your one that goes slowly. So if you're going to give a bolus IV, which means that you're just going to open it and just put a whole liter into someone, the problem with that is it's good if they're hypotensive and stuff like that, but the problem is that if they have a reaction, it's already like half of it already went through that. So you just want to watch out for that. And also, if it infused too rapidly, there are risks for overdose and fluid overload. So for your patients, for your heart failure patients, your kidney patients, you have to really watch out for that. And you generally don't want to give them too much fluid. When we are talking about injections, we always want to talk about injection safety. Most needle stick injuries are very preventable, so this is very important. You want to use needleless devices, so you put in the needle, you press the button, and there's no more needle. It goes in so you can't get hurt. In terms of the sharps container, you have to put all your needles and everything in there, and in that way, when you're doing the garbage, it doesn't come out of you and you don't get hurt. Here is stuff that you want to watch out for when putting in an IV or when giving medications through an IV, and these are complications. So number one, IV infiltration. What happens here is that instead of going into the vein, it goes into the tissue. And what you're going to see is it's going to be very painful. It could even have blisters and red at the site. The next one is phlebitis. Phlebitis is basically inflammation and clot due to trauma of the vein, and it causes it to be red and inflamed. So thank you very much for watching. Please like and subscribe, and stay tuned for the next fundamental video. Bye.